Great.
Good morning, everyone, and welcome. My name is Kerry Zoss, and I'm the Nurse Residency Program Coordinator at Stanford Health Care, and I'm incredibly excited to welcome you all to our fourth webinar series. I'm really focusing on a little bit of our program overview, some application preparation tips for all of you for our March application, and then some Q&A and time with 4 of our current and former nurse residents who are on the call today to answer any of those burning questions that you may have. I am joined today by my partner, Kevin Silvestre, who many of you know through Human Resources. He's our senior consultant for talent acquisition. So the two of us work collaboratively really to support all of you in recruitment efforts. And then once you're here, me and my team, our job is to support you through that first year of your professional clinical experience at Stanford. Very excited to be joined by 4 amazing nurse residents. Jayleen Malley is a clinical nurse in orthopedic surgery. She was part of cohort 29. She will be coming up on her 2-year mark in May. Anna Sullivan, and there's her son Jude, because we got to feature Jude, is a clinical nurse in our trauma ICU. She is part of cohort 32 and is about 7.5 months into her residency program. And then Lauren Perry and Jenna Kabahit are both oncology nurse residents, part of cohort 31. They will be graduating from the program, hitting their 1-year mark in April. So they're on the call today and are going to share their experience with application preparation. I'm just going to ask everyone if they could mute. Thank you so much. They're going to share their experience with applying, and then any questions you have about their onboarding, orientation, interviewing, what has made them so successful, please do so. They are a wealth of knowledge. So brief objectives. The goal of today is really to give you an understanding of our application process and expectations, as well as the requirements and some information on how we really review applications based on this concept of holistic review. We always get a lot of questions about timeline, placement, our goal, curriculum, and structure. So I'll give you some information on that, as well as the impact that COVID has had on your programs, and then how we've changed and modified our programs to meet those demands. Kevin, do you mind muting everyone for me? Thank you. So really, what is the goal? Really, what is the goal of the nurse residency program? The goal is really to bridge you from that advanced beginner role to that competent professional. All of you will come into our program as advanced beginners. You are not at that novice stage. You have gone through a nursing program. You have clinical experience. So you really come at that advanced beginner level. Our goal is to support you to that competent stage that really comes at that 1-year mark, 1 to 2-year mark. So how do we bridge this transition from education to professional practice? Our goal is really to work with you to develop effective clinical reasoning, critical thinking, decision-making, and communication skills so you can be successful. And in doing so, provide you with a really supportive structure, both peer support, resources to learn, and then a strong leadership team that can really help you during that first year and then after. In doing so, we want to ignite that passion for why you came into this profession, strengthen your professional and personal commitment, not only to nursing, but then to Stanford and to your unit and to your team. And then we realize that the next generation of nursing professionals are always thinking about what's next. And that is such a great thing. And so we want to support that. So really having open dialogue with you towards the end of that first year about what's next? What do you hope to accomplish? What are the goals you have? Is it a professional development plan? Is it an educational development plan? Is it both? And how do we get you to that stage? And then of course, everything we do at Stanford is rooted in the evidence. So really having you kind of bring that foundational knowledge that you got in your programs on evidence-based research, Why is it important? How do I keep that evidence-based inquiry and passion, giving you the opportunity to look at the literature, look at your practice, and ensure that what you're doing and how you're practicing is at the highest level of evidence. And if not, giving you the tools and the support to change that. Our curriculum follows the Vizient nurse residency program. We are aligned with Vizient. The Vizient nurse residency program came about a while back when there was a large attrition from nurses who did not complete their first year in the profession, and they were leaving the profession altogether. So what Vizient did is they took schools of nursing and academic medical centers, and they brought them together, and they said, how can we support our new nurse professionals in the clinical setting? And so they developed a curriculum that does not repeat what you have learned in your baccalaureate or master's program. That's not our goal, but really builds upon that, saying you've gotten that foundational training, you have strong clinical knowledge. We're going to take that and we're going to show you how to apply that at Stanford, according to our policies, according to our procedures, according to the workflow, according to your team dynamics, and giving you the tools and allowing you to think through processes, to practice, to simulate, so you feel like you have a robust tool set to go out and then perform at your highest level. We follow 3 domains, focusing on leadership, patient outcomes, and then professional role. Professional role can be anything from stress management, self-care, and nurse resiliency, to really, how do we be culturally competent? What do we know about implicit bias? What is our understanding of the social determinants of health? To how do we care for that death and dying patient? So really gives us kind of a broad guidance, and then we are able to kind of create that curriculum to not only fit the needs of our residents, but also to align with the strategic goals of Stanford. Really busy slide, don't want you to go too in depth, but I'm also asked, can you sum up what the nurse residency program is? And it's really 5 large buckets. First bucket focuses on that clinical orientation, which is the very beginning of your time at Stanford. So that onboarding, which is week 1 to the hospital, and then that unit orientation with a preceptor. The time frame dependent on the region that you're in. The acuity adaptable unit is the term that we use for our medicine, surgical, and oncology inpatient areas. And then we do have our critical care areas. So the time frame of orientation is really dependent on the region that you're hired into. If any of you have ever been on this webinar previously, you will notice that actually our time frame for orientation has increased for both regions by 2 weeks. That is in response to COVID. We have a lot of academic partnerships in the area, and we have reached out and spoken to many of your deans and professors, asking what is the impact that COVID has had in terms of time that you have been in the clinical setting. And so based on that, we have shifted our program to meet that need and make up for maybe any lost time that you had because of COVID. The other bucket is our monthly seminars. So that is time that you meet with the nurse residency program team. It is didactic learning. Right now we're doing everything virtual, but in the live environment, really interactive, a lot of case studies, a lot of group work, team building activities, opportunities for simulation. We bring in guest speakers, gamification, really to kind of bring these concepts to life. The first 6 months, very clinically heavy, using that clinical reasoning tool. How do I work through various scenarios? And then the second 6 months, more global concepts, implicit bias, workplace violence, managing challenging conversations. And then kind of towards the very end, the professional development, what's next for me? Again, we have an opportunity to do simulation. You work in groups, very different from the nursing school simulation. We're not grading you. We're just giving you the opportunity to take what you know and what we have taught you and to use it in a simulated environment. And then for your peers, you work in small groups to give you the feedback, what worked really well, and here's an opportunity. Again, we give you the opportunity to do some evidence-based project work with a group that aligns with the work that is either service line specific or unit specific. And then the last bucket is really our support system. So a lot of different ways that we support you. We bring former nurse residents in to talk with you. We buddy you up on your units when you come off orientation. But one of the main ways is our formal check-in process, in which you were assigned a member from my team, or it could be myself, and we're going to follow you for that entire year, meeting with you at specific intervals, so very closely within the first 3 months, about 3 to 4 times, and then right after you transition off orientation, 6, 9, and 12 months. And then in those meetings, we bring in your leadership team, your education team, your clinical nurse specialist, and your preceptor at the very beginning to really support you, work out any challenges, and get you where you need to be. Really proud of the growth that our program has done, especially in the last 2 years. We have 3 cohorts that are running, feeling like all the time, right, Kevin, and moving quicker than we can sometimes keep up, but we are growing exponentially, and we are excited about that. So we are looking around 55 to 60 nurse residents per cohort. So for fiscal year 2021, we're aiming to about 165 nurse residents per year. And our retention is pretty good. Our nurses stay. So we're looking all the way back to fiscal year 2017, and we're at 83%. So really excited that we're able to not only bring great talent, but retain great talent as well. Okay, so most of you are here because our summer cohort, which starts on June 28th, the application will open on March 1st. We are hiring into all of the areas that you see on the screen. We are hiring into all of our critical care areas, all of our oncology areas, all of our inpatient surgical and medicine areas, as well as our float pool, our observation unit. Our observation unit functions just as a regular inpatient unit, but because of billing purposes, it's referred to as an observation unit. It's part of the hospital. You work the same schedule, but you take care of patients who are only staying for a specific amount of time. We're very excited that for our summer cohort, we are expanding into our emergency department. So we are hiring into our emergency department observation area. Because this is a new area, I'm going to give you a little bit more information about it. It is also referred to as the clinical decision unit. Some of you may be familiar with that term. So it's patients that are seeking treatment and are triaged through the Stanford Emergency Department. And because of their clinical condition, they need further monitoring to determine, do we need to admit this person to an inpatient area, or can we treat them, see how they respond, and then discharge? So they go to this observation area for a specific amount of time where they are cared for and observed and provided treatment. And then based on their response and stability, they're either admitted as an inpatient or they are discharged. You, for all intents and purposes, are part of the emergency department team. You report to the emergency department leadership team, but you are hired into that observation area, which is adjacent to the emergency department. A little bit a timeline for cohort 35, which is the summer. So just so you're aware, this is the application window, March 1st to March 19th. And then the panels, May 10th through May 14th. That is both panel interview and then unit level interviews that week. And then the cohort start date is June 28th. And then for those of you who maybe are looking a little bit further ahead and the summer cohort is not when you're expected to apply, here's the fall cohort information. You will notice that there's a gap between application and then panel interview, about 2 months. Really the reason is because we get a lot of applications and we read every single one of them. We read every resume, every letter of recommendation, every question, amongst a very big team. We want to do due process and give your application the respect that it deserves. So we have a large team of clinical nurses who work as part of the nurse residency program and the Center for Education. All master's prepared nurses who read your application and then rate it. We don't give huge numbers of applications to one person. We don't want them to feel overwhelmed. So really we're looking at, can you look at about 13 applications per week? And then I take a very large pool of those and I call up Kevin and I say, okay, Kevin, we want to interview 220 or 240. So then Kevin works day in and day night, contacting all of you to set up those panel interviews. So that is why you will see about a 2-month time gap, because we really want to respect the process and all the work that you have all put into your application. Very briefly, I'm asked a lot about COVID and the impact to your application. We realize that many of you may have had modified clinical rotations or clinical rotations that were in person and canceled altogether, and you did virtual or call center or simulation. That's okay. We do not weight that in terms of your application. You are considered an applicant whether you had a virtual, a canceled, a modified, or an in-person clinical rotation. So they do not negatively impact. We are doing a lot to support you given how COVID has impacted your programs and your experiences. So we do a baseline knowledge assessment when you start. We kind of look at where you are as a cohort, and then we modify our curriculum to meet those needs. And then we follow up at the 6-month mark to kind of gauge where you are, and again, pivot our curriculum to see how can we meet them and where are they struggling. Again, simulation activities to really give you the opportunity for that in situ real life learning. We have brought in a lot of content on stress management, self-care, nurse resiliency, really to not only help you while you're at work, but dealing with the stress outside of work as well. Our goal is to continue offering 3 cohorts a year and to grow those cohorts and to expand. So we expanded into the critical care region for 32 and 33. We will do that for 34. They started yesterday, and we will do that for 35, and then excited that for cohort 35, we will expand into the emergency department as well. Okay, so really why you all are here is to really focus about our application. So the one thing that I want you to all know is that we are a mission-aligned admission selection process. So we look at an applicant's experiences, attributes, and your academic contributions. And we place value based on if an applicant could contribute to our learning, practice, and teaching environment. So we are looking at you as a whole individual. We want to see how you are going to impact our organization in meaningful ways. And by looking at you from a holistic perspective, we get the time to know you as the unique individual that you are. And so when you look at the application, specifically the question section on the electronic application, you will notice that they are not solely clinically focused. They are questions about you. They align with our Vizient domains as well as our professional practice model. That is the root of everything that we do. So you will see questions about advocacy. You will see questions about compassion. You will see questions about service. You will see questions about growth and resiliency, really trying to align with the professional practice model. And when you think of the professional practice model, I usually say, this is how you show up every day. This is what's expected of you. And so our questions align with that, and they give you the opportunity to really tell us about yourself, not just as a nursing student or a clinical nurse, but really about who you are as an individual. In terms of requirements, this information is always posted with the job posting, but there are specific requirements in order for your application to move forward. So you must be a graduate from a BSN or an MSN program, accredited by the Accreditation Commission for Education in Nursing or the Commission on Collegiate Nursing Education. Your graduation date on your transcript cannot exceed 18 months from cohort start date. So if you're applying for the summer cohort, the cohort start date is June 28th. So your graduation date must be in the 18 months that precede June 28th. No more than 6 months experience as a registered nurse, and that's full-time experience. So if you are doing part-time work, your timeline for work may exceed 6 months, but your hours should not exceed more than 6 months of full-time hours worked. And then you must submit all additional documentation. So for missing documentation, we say to Kevin, hey, Kevin, for Mary Smith, we don't see a cover letter. Can you make sure it wasn't a system upload issue. He does his due diligence and checks. And if he says, no, there's no cover letter, then we don't process the rest of your application. So you really want to make sure you have all of the components of your application. So we look for a cover letter, a resume. The resume must have your clinical locations and the hours or time frame that you are at each site. You don't need to have a description. You simply can say Stanford Health Care, Med Surg 1, 200 hours. St. Mary's Hospital, labor and delivery, 110 hours. Gives us an idea of the length of time and your experiences. If you have work experience, please share that. We look at all work experience. We look at military service. We look at customer service. We look at healthcare experience. So all of it, please share. We look at volunteer experience. If you have volunteer experience, we ask for the following, and we ask that you provide this so you get full credit for this volunteer experience. What was your title? And it could just be volunteer. My title was volunteer, or my title was youth soccer coach, whatever that was. What were your responsibilities and the hours volunteered? Please tell us the hours. If you have worked somewhere for a very long period of time, I want you to look over that time period and give us the best projection of what your hours would have been. We also ask for contact information, either for your supervisor or the agency, and either a phone number or email, so we can verify. You also need 2 School of Nursing clinical faculty instructor reference letters. So this is not a reference letter from your preceptor. This is where things get a little tricky. So the reference letter that you want to have is from your clinical instructor who works for your School of Nursing, who gave you the grade on your transcript. And when that individual signed your reference letter, it should say something like clinical instructor, Samuel Merritt University, or professor and clinical instructor, University of Pennsylvania, not Kerry Zoss, clinical nurse, Stanford Health Care, because that is your preceptor who works for the hospital. We want the reference letter to be someone from your School of Nursing. We ask that it be on school letterhead. It doesn't have to be on school letterhead, but it is recommended. And then your transcripts, either official or unofficial, and then completion of the electronic application, which we'll go over in a bit. Really, I get a lot of questions about what do you look for in a cover letter? What do you look for in a resume? So this is not to tell you to change what you have written. Your cover letter is an opportunity for you to share your technical skills and work experience, but also gives that soft skills and attitude and motivations about you. So I always say you may want to start by what was your journey? Why did you choose nursing? What brought you to this profession? And then what makes you uniquely qualified for this? And that's the accumulation of everything that you have done. Personal experiences, work experience, education, clinical rotation, volunteer, whatever that is, you can shine some light on that because that makes you uniquely you. And then perhaps you want to say, this is why Stanford, this is why I would be a great candidate for your organization. It's because I have this experience and I'm aligned with your values, and this is what I can offer. So your cover letter is that opportunity for you to sell yourself. This is who I am, and this is why you want me. So in any way that you can do that, whether it's providing some of this information or not, and you have another way, great, please do so. But give us a little information about who you are and why, and really why we want you. Resume, however you want to format your resume. We don't give points for creativity or the best structured resume. It's really the content that's provided on the resume. Again, the one requirement is your clinical rotations and the hours or the time frame at each site. And then again, share with us, did you have a nursing internship or externship? What was your work experience? That volunteer experience with that specific information we look for volunteer experience. Any certifications? Do you want to put your licenses? Memberships, awards, articles? This is all that time to share all the things about you. We read all resumes regardless of length. So if they're more than one page, we read more than one page. So we don't have that rule where after one page we stop reading. No, we read it all. Letters of recommendation, again, clinical faculty, not your preceptors. They do not have to be directed. They do not have to say, Dear Stanford Health Care or Dear Kerry Zoss. It can be very generic. Whom it may concern, we realize you are looking at a variety of different opportunities for employment. So the kind of standard letter of recommendation is fine. If your clinical instructors are saying, what are they looking for? Really, we want some insight on how you perform during your clinical rotation. So think about the nursing characteristics that you want to exemplify, that you possess. Maybe it's teamwork, compassion, maybe critical thinking, accountability, whatever those nursing characteristics are, we want to hear about those. If you have a clinical instructor who's also your theory professor, that is fine. If they write about your work in theory and your work in clinical, that is fine. We really just want to see, how did this individual perform in the clinical setting? Okay, then really the meat of the application is that electronic application. So again, has demographic information that sits with human resources. The only demographic information we get is your name. It will again ask your education history, your work, give you the opportunity if you want to put references, and then your license or certifications. And then this is where you get to rank. I would really like to work in ICU. And then if I can't work in ICU, I'd really like to work in medicine. So you will rank based on your preference. My goal with Kevin is, when we go through all of the scoring, is that we assign you to a panel interview in which you got your one of your top choices. So if you put ICU as your top choice and you met the criteria and you're ranked high, we want to put you in the ICU panel. And so our goal is really to put you in your top two choices. And then the application questions. So these are the application questions. Full transparency, we don't want to make this stressful. There are technically 5 questions. The first one, don't overthink it, simply asks, did you choose your clinical senior preceptorship site or were you assigned? That's it. So you can say, I was assigned to St. Mary's Orthopedic Unit. My School of Nursing assigned senior preceptorships. Or you can say, I put a bid for Lucille Packard maternity and I was assigned that because I chose that. It gives us an idea of, okay, this person is interested in this field, or this person didn't have an opportunity to choose. So no score is given to that question. It's more informative for us. These are the 4 questions. What you will notice is there's multiple components. So we'll read the first one. Tell us about a time during your clinical rotation where you experienced a caring moment with a patient. How did this moment affect the patient's outcome? And how has it changed your clinical practice? 3 parts. What was the caring moment? How did the caring moment affect the patient's outcome? And how has it changed your clinical practice? You must answer all 3 components to get full credit. And you will notice as we go through, all of these questions have multiple components. Then we move to the second question. Tell us about a time you had an error in judgment, also known as a mistake, can be personal, professional, or academic. So again, we want to get to know who you are. Doesn't have to be School of Nursing related. What happened? What did you learn from this experience? How has that experience shaped you into the nursing professional that you are today? Again, 3 parts. 4th, tell us about a time you provided service to community. It can be any sort of service. What was it? How has serving in community prepared you for a profession that is committed to compassionate service? 2 questions. So make sure you answer both. And then the last one, successful completion of a nursing program requires hard work, persistence, dedication, and resilience. Share with us what initially motivated you to pursue a career in nursing. That's your story. We don't weigh that. So if you say, my mom was a nurse, my aunt was a nurse, and my sister's a nurse, and I just always just thought they had just such great work-life balance, and I just saw their passion, and it struck a chord with me, that is your story. Great. If you say, when I was younger, my brother was in and out hospitals, I really saw the impact nurses had, and that's something that was a role model for me, great, that's your story. If you say, well, I was in customer service for 10 years, really didn't feel like there was a lot of human-to-human connection, so I did a second career change and went into nursing, great, that's your story. So whatever it is, that's uniquely you. We're not giving point value. What we're looking for is that you share with us what initially motivated you, what were the goals that you set for yourself. Again, those are your goals, and how did you achieve that? If you can demonstrate the resilience and the dedication and the hard work and what you did to get from point A to point B to applying and show us that journey, that's how you get full credit. So it's less about, oh, I have this great story, or my story is not really great, I just really always want to be a nurse. We're not looking at that. Those are both great stories and they make you uniquely you. We want you to show us how you got from point A to point B, because hard work, resiliency, dedication, self-care, use of support service, that's all what nurses need to be successful in their role. So if you can demonstrate how you've done that outside of work, we can say they can bring those tools and that ability into the clinical setting. Okay, I have talked a lot. We have 4 individuals on the call, and I'm going to ask each of them to share either kind of their tips, what they did, how they prepared for the application, what worked for them, perhaps what set them apart, to share with you. And I'm going to ask all 4 of them to share. And then when we're done with that, we'll open it up for Q&A. So I'm going to stop sharing my screen so we can see these fabulous nurse residents. And if you have the opportunity to turn your camera on, I always say do so, because it's more fun to see all of you. And I have a photographic memory, so I look at you and then I remember that's why I'm always looking at the screen. And trust me, the new grads will vouch for that. I remember very, very interesting things. So I'm going to start with Jayleen. I'm going to put her on the spot because she is our former nurse resident. She is in orthopedic surgery. She's coming up on her 2-year. So Jayleen, would you mind sharing with these 229 amazing individuals what made you stand out and what tips you have for them?
Yeah, good morning, everybody. My name's Jayleen. Nice to be here with everyone. Wow. Well, I think you guys have gotten a lot of information that is extremely beneficial. I just want to highlight a few things. One, be true to who you are. Obviously, I'm biased to Stanford and I align myself with their values. I think spending time and looking into what Stanford's values are and what other hospitals you are applying to is important. You want to be able to convey yourself and also work in an organization that values things that you value. Kind of like how Kerry was saying, when you're answering those questions, you should be natural and true to who you are. And if you naturally align with Stanford, that's going to show in the things that we're looking for. I'll talk a little bit about my application process. So I'm a Chico State graduate. I graduated in 2018. I applied for Stanford in December, kind of as like a dream, it wasn't really something that was high on my list, but I did it just because I thought, why not? When I was doing the application, I answered very much how Kerry said, I want to answer who I am, not the generic nursing student response, nursing grad response. When I got my interview with Stanford, I was really nervous, which I think a lot of people can relate to. It's a really normal feeling. I think for the interview, in addition to everything else you guys are already doing, preparing is going to be, the best thing that you can do. I spent a lot of time practicing scenario questions, which I think can be really helpful with certain categories. Kind of like how Kerry was saying, it's very clinical based in the panel interview. So I practiced questions about like, when did you have a difficult patient? When did you feel overwhelmed? When did you feel like you were a team player? Very broad topics. A time that you made a mistake, gave compassionate care, and then would write out my responses and then rehearse them out loud. I had other friends who were applying to other hospitals, and we would kind of ask each other these behavioral based questions and read through our responses and just practice them. Ideally, you don't want to be rehearsed. You can't be, because you don't know what they're going to ask you. But the more polished you are, the better you can advertise the best version of yourself. Um, and you don't have to spend time being nervous thinking about, oh my gosh, what am I going to say if they ask me this question? You kind of already have scenarios in your head. Today, I wanted to wear what I wore on my Stanford interview. I think that gives you kind of the best idea of how you should look in an interview. I spent a lot of research also on like the psychology of interviews, which you don't have to do. I'm just that type of person. So I looked a lot into that, but this is what I wore. So if you're looking for, what should I wear? There's a lot of podcasts, there's a lot of YouTube videos. We're not the first people to go through this. So use your resources. And I think most importantly, be confident in yourself and know that, yes, you want Stanford or you want to get this job, but also you want Stanford to choose you. And you need to sell yourself and show that. And advocate for yourself and put the best version of you in a way that's not showy, but in a way that is true to who you are. So Stanford can say, yeah, we want them to work at our hospital. I think that's everything. I don't want to take too long.
Thanks, Jayleen. That's great. Okay, Lauren, can you provide some guidance or insight? What worked well for you?
Thanks, Jayleen. That was, very similar to my experience as well. So I would just say again actually, first I'll start and just introduce myself. So I'm Lauren, and I graduated from the University of Utah in May 2019 with my BSN. And I moved back home to my hometown in the Central Valley. And I was, it was a shock coming back because I didn't have these connections coming back that I did back in Utah. So I actually, was applying to all these different programs and, really trying to get my foot in the door. So I spent a lot of time practicing interview questions that you can just get on, Google, or just doing a quick search. And similarly to Jayleen, I just wrote down some responses. I journaled a lot in nursing school, so I was reflecting on my experiences and just special experiences that I had with patients. And then I would just practice with myself. I would be walking around my house and just rehearsing to myself. And just like Jayleen said, not to go and, say something that I had said many times before, but just so then that initial stress of thinking, okay, how am I going to answer that question? That was pretty much gone for me. I was able to answer the interview questions with, highlighting who I was and really showing who I was as a person. So additionally, let's see, I think also I showed adaptability, and I would say that's very relevant, especially now with COVID. So during my time when I was applying for jobs, I signed up to be a substitute teacher. So if you're working another job, I think highlighting that too in your application is definitely important. It shows that, you're adaptable and you have unique experiences in that workplace as well. I agree also, like what Kerry was highlighting, to really look into the mission statement and the values that Stanford has. And you're probably already, you probably already have those values and have shown them in clinical experiences or other volunteer experiences. Just reflect on those and really show those and highlight those. And then let's see, also identifying a mentor, I think, is important in the clinical setting or, in your nursing school, because I had a lot of mentors that were able to look over my my application and just give me some tips. And also for their letter of recommendations, they were very adaptable to, and writing a bunch of letters of rec for me for my different programs. So I think that's helpful as well, and they can give you really great tips and tricks too. And yeah, just take time to really look over your resume and highlight any organizations you're a part of, or any volunteer experiences that you have. So yeah, I think they really gave you a great overview of the program and the application, and I'm really excited to see you all here and would be happy to answer any questions you have after.
Thanks, Lauren. Jenna?
Hey everyone, I'm Jenna. I graduated USF December 2019, and I'm in Lauren's cohort currently. We're almost going to be done at our 1 year. I work on E3 oncology, and my advice would be is my college had this thing called career services, and I utilized their resources constantly. During my senior year, I was going to them every week to go over my cover letter, to go over my resume, to do interview questions. And I basically lived there my senior year. And then I also reached out to my nursing friends, and we also did questions with each other. And one thing that I did that I found helpful was I would use one clinical situation, but I would be able to use it either in both like a compassionate care question, but also like a difficult patient question, but you just use different aspects of that question. So like in the difficult situation, be like, I looked at these vitals, they were verbally abusive, da 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 da. But then in the compassionate care is I took the time to try to understand what that patient was going through. And so you could kind of use one situation, one clinical situation to answer two questions. And I would write them down in a star format just to have kind of like a summary of what I was going to say. So situation, what was the task, what was the action, what was the result? And that kind of helped me summarize what I was supposed to say in that situation and like what was I answering. And then another thing I did is, or what my friend said is, your answer, it shouldn't be verbatim. The message should be the same every time you say it, but it should never be verbatim because then it's just rehearsed. You want it to be genuine, you want it to be authentic. And honestly, all of us are going through nursing school, all of us are equipped to do the tasks and skills, but what about you makes it special? What did you do that makes you stand out in that situation? So really like bring out your personality. And for me, my manager said the story that made her hire me was I just offered to wash somebody's feet. And I was joking about how her feet needed like a pedicure, and it was a good thing she was on the beach because now she got like a free pedicure. And she just like that I was able to make that patient laugh, and I was able to relate to her and like bring her back down. Like I was advocating for her right to like feel like a human being. And she said that's the thing that stuck with me. So like Kerry said, it could be the simplest things. It doesn't have to be something where you find their diagnosis or something crazy. It could just be something very simple. So like find those moments in your clinical settings that have stuck with you, and just take the time to kind of just write down like a log of what you did, the things that stood out to you, what you remember, and just use those. So that's my advice to you guys. Let us know if you have any questions, and we're all very happy to help.
Thank you, Jenna. And last but certainly not least, Anna, do you mind sharing your experience? Hold on, Anna, are you I'm trying to find you because I can't hear you.
Can you hear me now?
There we go.
Oh, weird. My headphones weren't working. Sorry, guys. Zoom newbie over here. So I'm about my name's Anna. I'm about 7-ish months into the residency program. I started in June. I'll finish in June. I'm in the surgical trauma transplant ICU, which has been the COVID ICU the whole time. And just last week went back to having surgical trauma patients. So that's pretty exciting. I have a little bit of a different sort of start to my nursing career. I'm a second degree student. So I had a career for about 10 years and then decided to switch it up. And I graduated from nursing school 6 months pregnant. So then right when I graduated, I couldn't get a job right away. So there was a gap. I've seen a couple of people in the comments saying like, what if I graduated at this date? Or what if I, had already passed the NCLEX or, timing issues. I was very worried about that as well, and applied, nervous that my examples might be kind of outdated or like not as fresh in my mind, because the people that I was interviewing with were like, oh, well, last week in my clinical experience or a month ago. And I'm like, 18 months ago, this thing happened. And I'm really hoping I remember the details. But similar to what the other residents have said, so when you Google, and I'm sure a bunch of you have already done this, but when you Google behavioral interview questions, a lot of times they come up in categories. So it'll be like leadership behavioral questions, and there'll be 5 examples, and compassionate care, and there'll be 6 examples. What I did was come up with a story that was a leadership story, and then figure out how it would answer those questions. So instead of having to come up with 30 answers to 30 behavioral questions that I thought of, I came up with 5 stories, 5 examples of clinical practice or clinical examples that resonated with me or were profound enough for me that they stuck with me. And then I just used my phone and I filmed myself. I don't know, this hasn't been brought up yet, but I don't know if it's still a requirement, but I was told that our answers should be like 2 minutes in the interviews. And pretty much at 2 minutes, they're like, okay, that's it, next person. So I didn't want to, come up with an answer that was like 7 minutes long. So I filmed myself and then practiced like, what are the most impactful parts of this? What can I cut out? How can I get it so that I'm not, like was previously said, I'm not being verbatim about what I'm saying. I'm just recounting it, but I'm only recounting the parts that are most profound. So I did that for about 30 questions. And I don't know if I'm going to remember this correctly, but I think 2 of them were asked. I think the other 3 were surprises. And a couple of them were like, oh God, don't call on me first. I have no idea what my example would be for this. Like scrambling in my mind to come up with something. But it worked out, luckily. And I would say my only other advice as far as the application process goes, and I know this is going to sound cliche and everyone before me has said this, but really be yourself. I know I applied to a million jobs and I didn't get any of them except Stanford, which I was thrilled about getting Stanford, but I didn't get any other interviews even. And I was super frustrated and knew that I had something to offer, but didn't know how to get my foot in the door. Didn't know how to just like get past those questions and get past my own nerves and all of that sort of stuff. And a friend said, if they don't want you, then that's a lucky break for you, because that means they don't see what you're offering. So be your truest self. And if it doesn't work, it wasn't meant to work. Something else will come along and be great. And there were previous jobs that I had applied to and I was like, yes, this is the job. Like, this is going to be a good application. And then I wouldn't get a call or I wouldn't get an interview and it didn't work out. And now, not to like preach the Kool-Aid, but Stanford is 100% where I should be. I'm obsessed with the people I work with. I love my managers. I love my unit. I feel like I'm growing a ton. I think the first comment was like, wow, the support that you give this program is incredible. And it is. Like the support that we've had in this program is, I've talked to people like other residents, and they don't have the type of support that Stanford's offering in this program. So be the truest version of you and trust that that's enough, and practice those questions. Practice. Prepare yourself. That's my advice.
Thank you all. I really appreciate the insight. I was a new grad 16 years ago, but I can tell you the process is much different. So that is why I bring our stellar nurse residents in to really give you some true perspective. I know there's a lot of questions in the chat, so I'm going to ask Kevin if he wouldn't mind kind of going through some of them. And if they're directed at our nurse residents, I'm going to ask them to chime in. And if not, Kevin and I can answer any of kind of the technical questions.
No problem. Can you hear me, guys?
Yes.
Awesome. Okay. First question. My question for the current nurse residents is, what qualities or characteristics of yours do you think have been essential to making you successful in the program?
Okay, well, I was just talking, but I'll talk again.
Go ahead. I'll go after.
Oh, Jayleen, you want to go?
No, go for it.
I would say the three most like critical skills or critical characteristics would be teamwork. So important. We're not like, I know that we're tested alone in nursing school. You are not alone as a nurse. And if you can't help out your neighbor or know when to ask for help, that is important. So being a team player, teamwork is super, super important. Humbleness, and that comes back to being able to ask for help. If you don't know something, don't know it. Don't pretend to know it. I mean, sure, try to figure it out if you have a minute, but like ask, because the worst thing you can do is say like, oh, I guess I'll figure this out. And then you don't, and too much time has gone by or something happens that could have been prevented had you been honest at the beginning. And like flexibility, adaptability. I was hired for the surgical trauma unit. I was not hired for a COVID ICU. I mean, I ended up, yes, being hired for a COVID ICU, but I didn't know that's what I was getting into. And neither did any of the other people on the unit. We didn't pick to be the COVID unit. M7, the AAU COVID unit, didn't pick that. It just happened. And that happens all through your career. That happens every day. Like, you know, things change. You don't expect to switch assignments halfway through your shift, and you do. And that's okay. You just have to be adaptable and flexible. So if you can find examples of those characteristics, I think that would be a strength for you. I don't know. Jayleen, what were you going to say?
I think that's great. I couldn't agree anymore. I think for applying to the new grad program and thinking even before your real, practicing nurse, passion, you have to have that passion, and that needs to show an engagement. You have to be willing to give 110% if this is something that you want. And you have to have the passion and engagement to show that, to do it, to work for it. And just, I think that's important.
Yeah, those were exactly the traits that I was going to say. And I also wanted to mention just having diverse experiences. I feel I actually did a capstone in mom and baby, so nothing close to oncology, but I feel like through my experiences with mom and baby, I was really able to pull some of the things I had learned and show it through my application. And I also apply things in my workplace too, like therapeutic, listening and having compassionate care with my patients.
And then
Jenna, anything to add?
Yeah, so the last thing I'll add is just being willing to get feedback and learn from your mistakes, and just have, like what they were saying, like that adaptability to, if you don't know something, don't pretend you do. And that's the biggest thing as a new graduate. You're always going to be learning, you're going to make mistakes. So having the ability to not let those mistakes drag you down, but just being able to learn from it and move on and use that to further your practice, because we're always going to be learning. You will make a mistake. So what are you going to learn from it, and how will that make you a better nurse in the future?
Okay, next question. Can May 2021 graduates apply for the June cohort, or should we wait for the October start date? So my opinion, it depends on your NCLEX, when you're registered for the NCLEX. Based on the upcoming posting, you have to have an NCLEX test date by no later than May 30th in order to be eligible for this June cohort. And then the other question was, are you guys hiring into L&D and OB? I know Stanford Children's have their own new grad program. And if you guys need the contact, the main contact person over there is Danielle Lee. And if you need her email, it's D as in dog, A as in apple, L-I @stanfordchildrens.org. Okay, let's go down. Suggestions for length of resume. I've been taught to keep it 1 page, but recently I've heard some school counselors that 2 pages are acceptable if we have everything on the resume, or if we feel everything on the resume is relevant. Kerry, do you want to comment on that?
Yeah, we again don't discriminate against length of resume. So if you want to put and you have substantial work experience, please share that. If you have internships, work experience, volunteer experience, put it all on there. I would keep it somewhat relevant. If it's something that you did 10 years back and maybe only did a job for 3 months and it's not really where you want to shine, you can leave that off. So I think anything that is relevant and somewhat timely, please put on.
Thanks, Kerry. And I think we answered this question too, but I'll mention it again. Are you only looking for applicants who graduated between specific dates? I'm currently at WCU and I graduated in 2019, however, was unable to work due to personal circumstances. So Kerry, you want to respond to that too?
Yeah, so we want to see your graduation, official graduation date needs to be within 18 months of the cohort start date. So a year and a half essentially. So look to see when exactly you graduated. And then if you're in that 18th month time frame, so the next cohort will be June 28th, then you're good to go. If you exceed that 18-month cohort, then you're not, or timeline, then you're not
Yung
eligible.
nurse residency dito sa staff.
We have a question from a member of our Stanford fam. Hey, Stanford fam. For those who are current Stanford employees, how soon should we reach out prior to applying and to whom? So the application dates are open the exact same time, beginning March 1st. And if you have any questions about the process, feel free to reach out to Kerry or myself. Is the residency program a rotation, or do we specialize in one specific unit, e.g. cardio, neuro, oncology, etc.?
So great question. So you are, when you sit for your panel interview, so for example, Anna, use her as an example, she selected critical care as her top preference on her resume or her application. And so she placed, we placed her in the critical care panel interview. She interviewed in front of 5 managers over 5 different critical care areas. The trauma manager chose Anna. Anna did not choose trauma. So it's, you get to choose your specialty and then you sit in front of that specialty and the management team from that specialty will say, I think that individual would be a really good fit for my unit. So for example, Jayleen interviewed in front of surgical inpatient from ortho to colorectal, to urology, to cardiac, to plastics and ENT, and orthopedic surgery said, I want Jayleen, I want to bring her back for a unit level interview. So they picked her. Same with oncology. It could be hematology, it could be BMT, it could be a mixture, it could be oncology. The management team really looks at the applicant in the interview. Do I feel like this person would be a good fit for my unit and for my team? Because if you think about it, every unit is looking for something a little bit different, right? Different cultures, how will this person fit in? This is what the expectations are of my unit. So they're looking for different things in applicants, so they choose you. I did see a couple things in the chat. You don't rotate through various units as part of your orientation. If you're hired in the trauma ICU, you're oriented in the trauma ICU, you're hired into that unit, you participate in the nurse residency program. It's, your participation is mandatory, but I don't hire you. I facilitate the program in which you participate for that 1 year, but you are hired directly into the unit and you report to the unit manager. It is, we post full-time positions only. I saw that as another question. So it's full-time, it's not per diem or relief positions. Okay, go ahead, Kevin.
No, thank you. Those were the next questions on my list. So thanks for answering them. No, because there was initial confusion when I post this on Facebook at times. So yes, you're an official employee of Stanford, full-time benefits, etc. So 2 questions related to degrees. Are you considering ADN students who are currently in a BSN program? Yes, if you've already completed the BSN. The main requirement here is the completion of a BSN or a MSN. So that response applies to the next question, which is about MEPN students. You must have completed your MSN degree prior to applying. Kerry, can a reference be from a faculty member? And if so, what or how?
And so the reference letter, it could be from your school faculty, as long as they were the ones who oversaw your clinical rotation, because you're going to want them to speak to how you demonstrated those qualities in the clinical setting. It doesn't have to be from your senior preceptorship. It could be from it could be maternity, psych, community health. It's totally fine. If it's someone that wrote your letter of recommendation and then retired, it's fine. They don't have to still be at your program, as long as they were your clinical instructor who oversaw your clinical and can speak to that. Doesn't matter what clinical rotation, and if they are no longer at your School of Nursing, that is fine too.
One individual said, "Can I put my preferred name on the application?" Yes, you have the option of putting not only your legal name, but what you're known as. So Kevin Silvestre, sometimes I go by KC, so KC is my preferred name. There you go. The next question here, Kerry, can you please describe the ED observation unit again?
So the ED observation is part of our emergency department umbrella. You report to the emergency department leadership team as your management team, but you don't work in the actual emergency department. You work adjacent into what is called the clinical decision unit or the observation area. So it is, consider it like a temporary holding area for patients who are triaged to the main emergency room, but whose status could change. So basically, interventions are provided to these patients to see their response. It's usually a 24-hour time window. Are they stable enough for us to discharge them home? They had a good response, or no, they're not doing well, we need to admit them. So it is caring for emergency room patients who have kind of a stability that still needs further monitoring before a decision can be made whether we need to admit them to inpatient or discharge.
Are there exceptions for students who cannot get 2 letters of recommendation from a faculty who supervise my clinical rotations? I happen to have the same clinical instructor for more than 1 rotation. Other instructors are no longer at my school. So what are your thoughts on that, Kerry?
I would, it's a good question. You stumped me. I would see if that clinical instructor could write one for a different rotation. And then if that's the case and you apply, I would reach out to Kevin and myself to let us know of that situation, so we're aware.
Regarding the application, someone asked if the application questions have changed for each cycle. For cohort 34, it's this, or sorry. Yeah, for cohort 34, it'll be the same question set. Can you still apply for this residency if you're a foreign graduate nurse and already have experience from your own country? No, because technically you're not a new graduate, and you will have to meet those minimum requirements per what's documented in the system. So no. Question for the nursing residents. What was the hardest moment in the program, and how did you go about handling it?
That's a hard question. I think that there's a lot of challenges with the new grad program, just like there's a lot of challenges in nursing school. I think in addition to becoming a new nurse, which is its own challenge in itself, adapting to the new grad program can be kind of challenging. It's extremely rewarding, but it's a dedication. And I think it's something that I know I didn't really realize. I had moved to a new area, started a new job, didn't know anybody, and then got involved into this program that was pretty, demanding. And I think it can take a lot if you don't take a second to reflect and take time for yourself and realize that self-care and that work-life balance is important. And I think that not only does that is that important for the new grad program initially, but continuously, and then also when you graduate and you're a nurse and you're just working and you're not in the new grad program. So I would say just creating work-life balance, and starting something new can always be intimidating.
Yeah, I agree with Jayleen. I think it's regardless of where you start, becoming a new nurse and working on the floor is definitely a challenge. And you know, those situations that you learn about in nursing school, it's completely different when you're on the floor. You're applying new knowledge, you're learning new things, policies, disease processes. And so how I overcame those and how I'm still overcoming those challenges is identifying, you know, someone or a few people on the unit that you feel like, you know, every time I go up to them and ask a question, they just jump in. So I have a few of those people on my unit that kind of give me comfort when I'm working the same shift as them, because they know me and I just know that I can go to them for anything. So having those mentors on the unit, keeping in contact with your preceptor, they have been there with you and can really relate. And I identified some of my fellow cohort members that are working on my unit, that we have a group chat and stay in contact. And I feel like I can go to them if I'm having any, you know, challenging times.
Yeah, and then there's just a lot of unknown as a new grad. There's a lot of situations that will be uncomfortable because you're either experiencing them for the first time, doing a skill that you haven't done since your sophomore 1 year of clinical. And so something a nurse said to me is you get comfortable being uncomfortable. And you get that way because you know your resources. Do I go to policy tech to see the policy and procedure? Do I go to my charge nurse who has years of experience? Do I go to my preceptor? And so it's really true. You get comfortable being uncomfortable, and then you get through the shift, and it gets a lot easier because you know who your resources are and you know who you could rely on.
Yeah, something that was said to me that has turned to be true is the hardest part for me, at least, has been the stress before each shift and during the beginning of each shift. And I was told, and I don't know, the other new grads, you might be able to talk to this a little bit better, but I was told it takes 2 years. It takes 2 years before you show up at work and you're ready to handle any patient that they give you or any patient load that they give you. And until then, every day when you show up, you don't know what you're getting. You don't know if it's going to be an absolute hot mess, if it's going to be an admit from 10 minutes ago and there's no real background and you're going to have to figure it out, or if it's going to be super chill. Like, you don't know what you're getting. And the first 6 months, well, the first 3 months, you know, you have preceptor. So you can kind of, I mean, you need to be on, but you can kind of be like, preceptor, can you come? Like, I definitely need you here right now. You know, you can lean on that person 100%. And then when you come off orientation, you're still like excited, nervous enough that it's stressful, but it's like, okay, here we go. Like, we got this. Like, I'm on my own. Like, how's it going to be? And then 3 or 4 months later, you're like, this is really freaking hard. Like, this isn't just like, you know, like, this is like, I have to know all these things. To Jenna's point, like, what resource do I go to? Well, that takes a minute to think through. You know, like, how long do I have to think through that? And so you find sort of your own way of what works for you. Like, for me, I have to get to work 20 minutes before I can even clock in. I need to be able to deep dive into a chart so that I feel comfortable when I'm getting a report that, like, yes, I already know that's their history. Yes, I already know they have these meds due. I'm still nervous every shift, and I'm still going to continue to be nervous every shift. But I can now walk into a hot mess and be like, okay, how do I need to organize myself so that while this is stressful, it's not going to be like, I'm not going to implode, basically, you know, like, I'm going to be able to like work through this stress. So I think for me, the hardest thing is like, after the shininess wears off, still being able to weather that stress and being able to know who you can lean on and what resources to go to. But I still love it. Like, still what I want to be doing. And, you know, my researchers are awesome and I feel really lucky for that. So I would say overall the stress is legit.
Anna, thank you. You answered one of the questions from the group. It said, how did you get the support you needed to be in your ICU? And how did you overcome the challenges you faced in the beginning? Did you have anything else to add?
I would say that Kerry mentioned this, that there are like check-ins with either Kerry or somebody else. For me, it's a woman named Julian. Our managers have open door policies. When they see me in the hallway, they stop and ask how I'm doing. The first, like all of our resource nurses, the staff itself is incredible. During my preceptorship, I like apologized to my preceptor because I screwed something up, and I was like, I'm sorry, you must be so frustrated. Like, I don't know what I'm doing, whatever. And he said, are you kidding me? Like, it's in my best interest to make sure that you are super comfortable, because in like 2 months, you're going to be my neighbor. And I want to make sure that you can help me and I can help you. And so I got support from everybody around me, not just like Kerry's level, but the managers and my preceptor and my resource nurses and the people right next door. Like, that's just the way. I don't know if you guys, the other new grads, feel the same way, but that's the way my unit has been from the beginning. So I feel really lucky in that sense.
And then another question to our residents, former residents, current, et cetera. How can I best research the various units to determine what is best for me? I'm unfamiliar with what a nurse does in different departments outside of my clinical experiences. So can you shed light on that too?
Yeah, I was in, kind of the same boat. I feel like every hospital and unit functions differently. So I know there's a few resources out there, on YouTube that you could watch, and some people kind of document or like run through their day. So I found that was helpful, and I'm happy to share what a typical day on an oncology BMT floor looks like in a later on, or if you reach out to me.
I think that's a very common feeling. I also felt that way. I graduated from nursing school not really knowing what I wanted to do. And so I think really what I recommend is reflecting on your senior preceptorship and where you were placed. Is it something that you can see yourself doing? Mind you, yes, this new grad program is a year, but it's not your whole life. Your nursing career can be many, many years. You have a lot of opportunities later on. So keeping an open mindset, I think, is important. I had my senior preceptorship on a medical surgical unit. So I figured, I liked that. You learn a lot of great qualities as a new nurse. And I knew that there was things that I didn't want to do, like oncology, like there was an ICU when I applied, but that's not something that I would have chosen, not emergency. So I think kind of narrowing down what you don't like and maybe having an open perspective on what you do like or could be interested in, even though medical surgical is so broad, you learn so many good qualities as a new nurse. And in all of those scopes of practice, you learn good qualities as a new nurse. But I think the YouTube is a great resource. Talking to your nursing school clinical educators, your preceptors in nursing school, they're going to offer so much expertise and advice on that as well.
Kerry, question. Last semester, I did not have a single day of in-person clinicals due to COVID, but still had a clinical instructor and did activities with that individual. Would a recommendation letter from this instructor count, even though she technically didn't see me work in a clinical setting?
Yes.
And then, does it hinder my chances if I have not completed my CCRN by the interview panel? No, not at all, because the only requirements right now that we're looking for is a confirmed NCLEX test date and or you're licensed, officially licensed in the state of California, and your AHA BLS certification. Those are the main two requirements for a clinical nurse one here at Stanford. ACLS obviously is highly preferred. A lot of our candidates already have that, but you do have the option of obtaining ACLS within 6 months per our job description. Can you apply to the program if you've applied before within the past 6 months? Absolutely. We've had people who were rejected twice and got in the third time. So keep on doing it. As long as you meet the minimum requirements and are within that 18-month limit, please continue to apply. About the program, Kerry, is this a schedule like nursing school where it's about 2 to 3 days working on the floor and then 2 days in classes? How is didactic learning and working balanced in that schedule?
So the nurse residency program meets for 8 hours every month for 1 year. At the beginning, it's broken down into 4-hour sessions. So you maintain that 12-hour orientation shift. You don't work more or never scheduled more than 40 hours a week. And then you'll get the whole schedule when you onboard. You get the whole seminar schedule for the whole year. And so then you just work with your manager to say, okay, I'm going to work 2 12s. I'm going to have an 8-hour seminar class, and then I'm going to take 4 hours of PTO, or I'm going to work 4 hours on the floor, or I'm going to work 40 hours this week and work another 8 hours on the floor. So it's really on staffing need. But essentially we meet once a month.
And then to Jayleen, Lauren, Jenna, Anna, if you did a virtual panel, what other tips would you give to adapt or to be mindful for that type of interview? Just how to prep.
So I think the only one on this call who did a virtual panel, not to put you on the spot, was Anna. The rest were in person. So any tips, Anna?
So I don't know about anybody, but I didn't even know, I had never had a panel interview, period. So like, I think that there's preparing for a panel interview and then preparing for a panel interview remotely. And the remote stuff is sort of easy. I mean, this sounds silly, but like check your background, make sure there's not something like embarrassing right behind you. Check your internet connection, make sure that, in my case, that my screaming toddler, who you guys have not heard yet, thankfully, he is in a room over there. Make sure that you don't have distractions that are going to like run in and interrupt. Just sort of like professionalism stuff, you know, make sure that you're crossing your T's and dotting your I's. One piece of advice that I will give about a panel interview in general, and other new grads, I don't know if you guys want to chime in on this, but I was very confused, I guess, about what a panel interview would entail and how I was supposed to answer the exact same question that the person to the right of me had just answered, or the person to the screen on the right had just answered, and like sound unique when it's the same question. And they're like, okay, Jayleen, okay, Anna. And you're like, okay. So the one big piece of advice I would have is encourage your other panel mates. Like if engage, if somebody else answers a question that you think is interesting, or you think, I mean, you don't have time to respond, but your face responds. Like, you know, one of the girls that is a new grad on the trauma floor with me and has become a good friend of mine. She graduated or was graduating like the day before the interview. And I was like, oh my God, congratulations. It's amazing. Like, that's so cool, you know? So like engage, know that the other people interviewing are human and that you want to lift them up too. You know, you're all in this together. So I think that it's more difficult to show that engagement on screen. And so you have to work that much harder to make sure that there are no distractions and that you're making eye contact with the camera and all that sort of stuff. Don't be like checking your phone in the middle of your interview, like off on the side. Like make sure that you are there and that the other people feel your presence.
I'm just going to piggyback off of that really quick. As nurses, we demonstrate human-to-human connection every single day. If you can't convey that human-to-human connection in an interview with your colleagues, then the interview panelists are going to say, probably can't convey that to a patient. So the more engaged you are in an interview with your colleagues, showing that human-to-human connection, engagement, compassion, relatability, even if it's just a smile, a nod, that's going to show your future hopeful employer, like they can do that to this person. They're probably doing that to their patients every single time they go into their room.
And one last question before we go into Kerry's final section. Any advice from the four about the second unit-based interviews and what to do to stand out, calm my nerves, etc.?
I will add one thing to the unit-based interviews. So it's a little bit more intimate, right? It's no longer a panel. How managers structure this could be different. Some are strictly behavioral, some bring in staff, some it's just maybe the manager and the assistant manager. What I always remind people when you interview is you are having a conversation with somebody else. And other person is trying to get to know you. It's like going on a blind date. If you sit on a blind date and you're like, my name is Kerry Zoss, I'm my BSN, I graduated from USF. Or if you're like, hi, I'm Kerry, I'm a graduate of USF, I'm a San Francisco native, super excited to be here. How will it go, right? That person's either gonna call you or they're not gonna call you. So it's a conversation, like they're trying to get to know you. That's why sometimes the questions are like, what are you passionate about? If you're passionate about working in your garden, say that. They wanna hear that. Not everyone is passionate about patient care 100% of the time, right? Let's be real. Like, I love to bike ride. I love to play with my kids. I love to bake. I love to watch Netflix. Like, be true to you and share that. People who do really well on interviews are often people who go, sorry, I'm really nervous. They crack a smile. Everyone says, it's okay. That was Jenna. And then they're able to shine because they get that moment of like, okay, I'm good. So allow yourself to be who you are. Like, that's what makes you you. That's what makes Anna, Anna. Like, you look at these people who are these residents, they're all smiling. They all have a bit of humor. There's a little bit self-deprecating, like, oh God, this is what I did. But it's who they are and it's why they were selected. Because if you walk into a patient's room and you're like, my name's Anna, and you're in the trauma ICU, and sorry you got in that car accident, and welcome, you're gonna be a terrible nurse. But if you can connect with someone really, really well and be like, hey, don't worry, I'm here for you. I got you. We're gonna get you where you need to be. It's instant. It's what Jayleen said. And that's what makes nursing such an awesome profession. It's the only profession you can walk into a room and trust is built in seconds. And we gotta make sure that you can be on the other side of that trusting relationship. So that's why we wanna know who you are. Okay, we wanna be mindful of your time, and we just hit that 11:30 time period, and my nurse residents are gonna laugh, but guess what? I survey everybody, them, all of you, because your feedback is super important. Please let us know how this session was, for questions and any feedback you have for Kevin and I on how we can support you, make this better. There will be an interview preparation session before the interviews in May, so look out. We'll blast your School of Nursing again. Kevin posted on social media, so if you don't follow him, please follow him because he'll give you all of those updates. But let us know how we can be support for you guys because you are the future of nursing and we need you. I want to thank my 4 nurse residents. You guys are awesome. Thank you for joining us today. Thank you, Kevin. For the rest of you guys, have a great week. Look forward to reading all of your applications in the next couple of weeks. And if you need anything, reach out. Take care, you guys.
Thank you. Bye.
Thank you.
Thank you.
Thank you.
Thank you. Thank you all.
Thank you so much.
Thank you so
you.
much.
Thank you so much.
Thank you.